If you're in the beauty industry, you're going to want to keep listening. Welcome to Salon After Hours, where the tips are on trend, the gossip is hot, and the advice is cutting edge. Grab your tea because we are about to spill it.
Hello, and thank you for tuning into another amazing episode of
Salon After Hours.
We are here with a super fun guest to talk about all of your beauty needs, but not with makeup. So go ahead, and here she is.
Hi, my name is Nurse Liz from Vital Therapeutics.
Welcome. We are so excited to have you. And where can everyone find you on Instagram?
So you can find me at Vital Therapeutics,
Awesome.
and the handle is right here.
Perfect.
Go ahead and follow me.
Perfect. So tell us a little bit about yourself, who you are, what you do, your background. Let everyone get to know you a little bit. We're really excited to have you.
Definitely. So born and raised in the Bay Area girl. So I've been a nurse since 2011. So I have a lot of background, both in the business side of things. I have my degree in business, and I also have my degree in nursing. Went back to get my master's.
Wow.
So a couple of years ago, I started my beauty business. So that's what we're going to be talking about today. I'm so
Yeah.
excited. Lots of stuff going on, preventative, skin stuff, lots of surgeries. So we could talk about that too,
Oh my
and
gosh,
kind
yeah.
of go into what everybody's doing right now to stay fresh.
Yeah, I love that.
I love that.
Oh my gosh, I'm so excited. So what are all the range of services that you do exactly?
Yes. So we do from skincare to Botox to microneedling to Easy Gel to Radiesse. So we have some stuff for like the natural girlies too, that like a lot of people talk about, like Botox being a toxin. We'll go more into that, right? Because
Yeah.
it paralyzes a muscle, but that's what keeps us kind of snatched and looking good. And then we also have stuff like microneedling, which is super beneficial for the skin. And we use your blood. We infuse that back in to increase collagen production. And of course, top it off with some medical grade skincare.
Okay. I don't know much about this, so I'm not in this world. So I'm very excited to like learn a lot of this stuff.
Yes.
So what was the other one? You said Easy Gel? What is that?
Yes. Okay. So Easy Gel is popping off right now. So it's really popular in LA. And so what happened, you guys have all seen kind of the Kylie Jenner kind of like puffy filler face, I guess you want to call it, right?
Yeah.
So what happens is sometimes when people keep getting fillers, it's just a little bit too much, but
Yeah.
you don't see yourself because you're just kind of used to it. But
Yeah.
like in her case, maybe they just didn't want to tell her no. And she's like, kind of like, let's go. So it got to a point where it was a little bit too much, especially for the under eye. And so she pretty much dissolved it all. And so through that process, physicians were coming up with something more natural. So that's when they came up with Easy Gel. And so we brought it on about a year ago. And basically we draw your blood, 2 vials, and then we heat it and cool it. And we mix it together. And
Oh my
so the
gosh.
heated portion creates a thicker consistency. And that helps with under eye hollows. And the PRF on top of that helps with like darkness. And so a lot of girls have like under eye issues. And this is like an all natural way to fix it. So it's 2 sessions, 6 to 8 weeks
Interesting.
apart. Yes.
So that gets like injected, or that gets like a cream on your face?
It's injected.
Oh, okay. So it's like Botox, but you're just injecting like your blood back into you, kind of, right?
correct. So it's a little bit more
Interesting.
like of a filler consistency.
Okay.
So it's a special technique that you learn from a trainer. And obviously this has to be done by a registered nurse because
Yeah.
there's a lot of talk out there of like who's doing what, right?
Yeah.
So as a nurse, I get a trainer assigned to me, like a national trainer. She comes and teaches us the correct techniques because when you're accessing someone's under eye,
Yeah.
there's a lot of facial features that you need to avoid, right?
Yeah.
So we use a cannula and you're going to see results right away. But with all natural stuff, it takes a little bit more time for it to work. So 2 sessions, and then you're really going to start to see some results.
Have you ever heard of this, Brie?
I have, but
Okay.
I haven't done it. And, you know, you guys, I'm sharing my secret girl here, okay? So Nurse Liz is the one who actually does all of my Botox. I haven't like gone into all of that other stuff yet until she tells me like, hey girl, you need it. So anyways, she's done Botox on me, lips, lip flip, which ooh, I want to get into that.
I didn't think about a lip flip.
Yeah.
Oh.
So I want to get into all that with her too, because sometimes I have some like, I feel like a personal opinion on it, and I really love it. And I feel like it's a hidden gem that a lot of people don't know about. I guess we could just get into it now, right?
Yeah, just go.
I feel like, so I've gotten my lips done with Nurse Liz, and they were fabulous, right? But then I was like, okay, I'm a little bit of a baby, so I'm like, the lips do hurt. Honestly, Botox on my face doesn't hurt, but the lips do. It's more sensitive. So anyway, so it's not my favorite thing to do. But one time I was like hearing a lot on Instagram and about like lip flips, and I was like, what is a lip flip? And she was like, oh, it's like actually if you take your fingers and you kind of like push it in, it'll like bring up your lip a little bit, you know? And I was like, ooh. So then, like, you look in the mirror and you're like,
That's right.
okay, I want that. So anyways, I got it and I love it. I even like it more than getting my lips done. Like, I feel like I could get a lip flip. I mean, let's be real. Probably do my lips maybe once a year, but lip flip
That's right.
in between.
That's right.
Because I just feel like it makes it look so much more natural, and you don't look like that like duck face that sometimes you see, that botched look. It's a little bit more subtle, and I like it a lot. So I'm like, sometimes I feel like a lot of girls don't know that like you don't need maybe your lips done. Maybe you need a lip flip.
Yeah. So that goes like right here or something, like above the lip, or where does
Go
that
ahead,
go?
nurse.
Yeah.
Nurse, let's
I'll
get in
take it
here.
away. I'm gonna take that one. No, so basically it's Botox. It's about 8 units of Botox,
Yeah.
and what it does is it kind of refreshes you after your filler. So a lot of girls, again, just like Bree said, you don't want to keep getting filler. You just kind of want to refresh it in between. Because if you've seen TikTok, some girls are like, "Where did my lip filler go? Like it kind of went away. My body metabolized it." That does happen to certain people. So if your filler stays and you got it, but it's starting to slowly go away, getting metabolized by your body, then you can get the lip flip. And so we do 2 units, 2 units, 2 units, 2 units to kind of flip the lip up just slightly. And so we also use it for people that have a gummy smile. So when you smile and your teeth show, it just shows a little bit more of the lip. And so it kind of takes that gummy smile away for a couple of months. And we're yipping and yapping. We're talking all the time, right, us girls? So it's only a small amount of units, but it's super effective for at least 2 to 3 months.
Okay.
But it's also cost effective too.
Yeah.
So if
I
you
was
want a little
just going to say.
Yep.
Okay.
So if you want a little pick me up in between, or you're going to like a wedding, or you're going on vacation, it's a super easy, super quick. Literally, we're talking like 10 minutes.
Not
wow.
even.
I mean, I got to do a consult, all that good stuff. But
Okay,
yes,
okay. If you count
you're
the
my
consultation.
if you're my patient already, you're right. It literally can take me like 2 minutes.
It's 4 pokes, like 2 minutes. It really doesn't hurt. Like they're just 4 teeny little pokes right on the top of your lip. And then you'll notice. And how long does it take to kick in?
It usually takes like at least 3 days to kick in, but by day 5 to 7, you're noticing a good change.
Yeah, I love it.
Yeah. Okay, I have a really dumb question.
No dumb questions here.
No dumb questions.
Okay,
real
like I said, I
questions.
don't know any of this world. So what is the difference between Botox and filler? I don't even know.
Good question. So a lot of people ask this, right? So Botox is more of like a muscle relaxer. Okay. So when you lift up, your forehead like kind of moves and stuff. And so when you frown, most people like RBF, right? Because you're just like kind of like, but it just prevents those lines from forming. And so filler is more, it gives volume. So with Botox, there is no volume. We're just minimizing the muscle movement. And then filler, it just
Plumps.
gives you a little bit more of a plump. That's right. And just added volume.
So is it both injecting like different solutions or something into your face?
Correct.
Okay.
2 totally different things.
Okay.
So filler is hyaluronic acid. It's already made in your body, but you know, we talk about like filler migration and stuff, which is crazy right now. A lot of people are getting a lot of things dissolved. Sometimes it could be injector error, but it also could be when you kind of keep asking for a little bit more, like we were talking about earlier, like there's only so much space that
Yeah.
the filler can go.
Yeah.
So it's up to your injector to really be like, we're done, or we have to
Mm-hmm.
dissolve and restart over. Because even sometimes after you get a couple of your lips done, a few times you just really need to dissolve it and kind of start all over.
Talking a little bit about the dissolve part, I mean, I've heard a lot of
Mm-hmm.
people say that that's more painful than getting the actual service. And like, what's recommended for like how often you should dissolve and all of that world?
Yeah. So some people are super, super specific. Like I actually had a girl, she's so sweet. She went to LA. They made her dissolve for a really expensive price, came back to get those specific lips that she wanted. And then it was not good. And then I had to dissolve her again. So you have to be really careful, like who you go to as far as dissolving. If you know your product is moved, you don't want to put any more product in there, right? And so that's up to like discretion of your nurse. But I wouldn't say you have to dissolve unless it's not looking good. Okay.
Okay.
Probably a lot of the cases are people that go overboard with it, huh? Like that they just keep adding, and then maybe it becomes too much. And then, because I feel like I don't know that many people that have dissolved, unless like they get like a gnarly bump or like they used to inject a lot and they're like, oh, I don't like this look anymore.
Totally. It's kind of becoming a little bit more common for injectors not to want to work over somebody else's work. If you've gotten it a while ago, and then there's some studies that show like, filler stays for a really long time. But if your filler is staying in the right spot, it's not a problem. But again, if it's migrated, then that's when we got to go in and do it. And as far as it hurting, so there's a lot of different ways to kind of help with that, because some people go in for microneedling and they're like, oh my God, it was the most painful thing ever. And they don't want to ever do it again. And it's not. I think there's so many different types of numbing cream. So I have a little bottle like this. It's $100. So because it's medical grade, it's compounded at a specific pharmacy. But I can also buy some from Amazon for $15. So if
It's
you
do your homework.
cost effective for your injector, whoever is doing it. So that's a big part of it, because a lot of the times you'll use lidocaine prior, and that's an additional step that I have to inject into you to make it comfortable, because the last thing you want is for your patient to be in pain and never come back.
Yeah. I'll be
Who
that
wants
girl with the lidocaine.
Do you see what I'm saying? So,
Yeah.
and I know Brie was talking about the lips, and it does hurt. So the lips are super vascular. So a lot of the times we'll either do a dental block, and you'll be completely.
That's what I was gonna say. You started doing that now, right?
When is
Like
that?
I heard her talk about that because I haven't got my lips done for like a while now. I got a lip flip, but I feel like it's been like a year now
Yeah, I
since
think
I've gotten
so.
them done. So, but I'll probably be the girl that wants the dental block now. Jesus, like just
Yeah, what is that?
So it's lidocaine into two different areas. You can either put it inside of the mouth or outside of the mouth, and it just basically blocks. It's kind of like when you go to the dentist and they inject you to
remember
do
they
like
do
a
it the first, and
cavity.
it's a poke, but then you
Yeah.
can't feel anything.
Exactly.
Yeah,
So a
okay.
lot more injectors are going to that, because you have to like know your patient. And some people are like squiggly all around, and
Sweating bullets.
totally. So it's like
I mean,
wasn't too bad.
I wasn't that bad. I've seen worse.
Totally. I have like this little vibrator thing, and when you look, and then so people are like, "Where's your vibrator?" It ran out of battery the other day, and they're like, "Where's the vibrator? Where's the vibrator?" I'm
That
like,
is
"Honey,
so
I'm so sorry.
funny.
I need to get a new battery." But there's lots of different ways to like make sure you're
Yeah.
comfy.
I will say, like, Nurse Liz is like so good at making you feel comfortable and figuring out ways to make the experience better. Like for her to get a little vibrator tool and like you kind of like put it on your chin so it distracts you, so you're not really
I've seen
feeling
that.
the
Yeah.
pokes. She goes like above and beyond for that. And she hasn't mentioned it, but she is mobile. Like she can come to you. Like
Yes.
I'm like every hair appointment that I do her hair, I'm like, okay, what do we need here?
Oh,
So
right.
she's mobile, which makes it so convenient.
That is so fun. So what, in terms of mobile, like have you done like, I know you did the 925 party. Have you
That's
like, is that
right.
common? Do you do like bachelorettes and fun parties like that?
Yes. So
How
I've done several different things.
Yeah.
And so I'm mobile and I'm in office. Obviously, for the procedures that we have to do, like under eyes or accessing or anything like that, specific areas, we have to do those in office.
Yeah.
But for like Botox, it's super easy to come and like obviously time saving for everybody.
Yeah.
So when you're at work, like I can even come to your office. Like if your boss is cool, sometimes I'll have like literally like meeting rooms set up and the girls just kind of come in and
Oh, wow.
so I've done that. I've done like workout places. So we just did a Pilates place.
Oh my gosh,
So
how
cool.
fun.
Yes, bachelorette parties and people getting ready for their weddings. And so, yeah, it's been really fun.
That
So
is
fun.
so cool. So I want to talk a little bit about more of like the schooling and like that kind of background, how you started, what's required if someone wants to like do what you do and get into that world and that business. If you want to just kind of share your story in terms of where you started and all of that.
And
sure.
also because I do think we'll have some listeners that are interested, and I have heard that like there's different paths how to do it, and maybe something that you personally recommend, like going through it all, like, oh, you know what, I would do this instead, or
Yeah.
Definitely.
you know.
Yeah.
I get asked all the time by so many baby nurses that are coming up. And honestly, this is like one of the best things that I love to talk about because like I want to help everybody like to be able to do it if they really want to. And I think you need so much drive to start your own business. That part's wild. So we'll talk about that a little later.
Yeah.
But as far as business and as far as schooling goes, you have to be a registered nurse. All right. So in the Bay Area, it's super impacted because everyone wants to be a California nurse because luckily we get paid pretty well. Okay. So getting into a nursing school, like right off the bat, you need to do all your prereqs, you need to do all that good stuff. And then getting into nursing school is probably one of the harder things. And talking about nursing school, we have so many tests. So be prepared for that because there's like a test on your knowledge because you're literally working with people's lives if you're not doing aesthetics. Luckily, I've done both, so I feel super comfortable, right? So once you get into nursing school, you're done, and then you take your licensing exam, your NCLEX, and then you're a registered nurse. So there's a couple different things that you can do. You can go to an associate's degree, you can go to a bachelor's degree, but again, since it's super competitive, you want to have like the best and more schooling to be able to get hired because if you're going up against a lot of different people, there's a couple factors, right?
Yeah.
And schooling is one of the top ones. So once you I always recommend getting, if you're really interested, a little bit of background in the hospital, just because like you went to school for all that time. It's nice to have that. But honestly, you can hop right into aesthetics. And if I would have gone back, maybe I would have done it to hop right in. But I don't think I was just ready to get all that started, right? So there's places like Laser Away that are like really big places that kind of hire newer aesthetic nurses, and they'll show you how to do like laser hair removal and different things like that first. But you obviously have to have your degree. So number one, then you get hired into aesthetics. And then, for example, you start doing laser hair removal, and then you might hop into Botox, and then you might hop into fillers. So you're kind of getting progressively into different things. For me, the route that I chose was I started my own business. And then once you start working with your manufacturers, they start sending you the trainers. But I learned really well like doing things. So I
Hands-on.
personally pay for a trainer to come and train me and like one other person because I get more hands-on experience that way. And that to me is golden because I can't listen to you talk and get it. It's just not working for me.
So the other part of it, if someone doesn't come, is like you watching a video kind of training?
Or you go to like a bigger training. Like let's just say, which is also good too. But
in a
I'm just
big
saying to
classroom.
hands.
Okay.
Yes, exactly. So there's like 15 nurses and you're kind of just watching what they're doing. Or like at a conference, you can sign on to go to different things. But you have to have like your patients ready. Once you learn something, you really need to do it. Or at least I like to do it multiple times. And I think that's one of the biggest things when you're a nurse in aesthetics, like, of course, something's going to go wrong, right? Even with Botox, I think the number one thing that goes wrong is you might have like a little brow,
A stiff
Yeah.
a stiff brow, like a spocked brow, right?
Yeah.
But literally, you don't have to live like that for the next 6 months. You just call your injector and be like, hey, my brow went a little bit up. Can you fix it? 2-minute fix.
Oh.
So your nurse injector needs to know how to fix these subtle little different things. Okay, I might have a little bump, like brace it on the lip. Okay, we can Hylenex that. So little things like that. So
question.
Yes.
Nursing school to get your degree, how long does that take?
Yeah.
So, as far as if you want to get your associate's degree, you can go for 2 years. So you need to take your prereqs to get in. That's 2 years. So I actually went to Chabot,
Okay.
and I had already had my degree in business administration. Then I went to Chabot for 2 years, and then my work paid for me to go back. So you can always look into things like that. If you're working somewhere and they pay you to go to school, like always super take advantage of that, because you can either go the 2-year route or you can go the 4-year route.
Okay.
And then the 4-year route is your BSN. And you can also do associate's degree and then bridge over to a BSN. But I always tell people you just want to get in the nursing program any way that you can, and then can kind of continue on, because once you have your degree, that's when you can start to do things with it.
Got it.
Yeah.
To get into the nursing program, though, do you have to do your AA first out of college, or you can just right out of high school go to nursing?
Right out of high school,
Oh, okay.
you can go to nursing. So
Oh.
we have some like new grads that are
Yeah.
like 22 years old. I
Yeah.
love them. They're so cute. They're
Yeah.
just like fresh out, like I
Yeah.
got my first job, you know?
Yeah.
So you can literally go straight
Oh,
out of high
wow.
school. And a lot of people like will work as a CNA. The hospital's tough, like no lie. So you always want to be like either a volunteer at the hospital. That's always like a good thing to kind of be able to see. Or like I said, I get girls calling me all the time. Can I come shadow you? Can I come watch you? And I love that. So I'm always like, of course. And we just have to find a time that works for both of us, but 100%.
Oh, interesting. Okay,
Yes.
so go to nursing school 2 or 4 years, 2 to 4
Correct.
years, somewhere around there.
Mhm.
And then after that, you kind of do those trainings to learn more about the actual procedures and stuff like that, right?
Correct. So you always kind of go, you don't like, I even didn't learn how to do like Easy Gel until like almost 9 months into like doing Botox and filler and stuff. So you kind of go in a progression.
Yeah.
I'm not saying that you can't learn it all at once, but you kind of want to have a little bit of
Yeah.
something and
Yeah.
You know, you want to practice it, but
Perfect
like
that and then move on to the next. And nowadays there's like new procedures and new things coming up all the time, right? So it's like
100%.
you always have to evolve and learn the new things to stay up with the trends and all that. So,
Exactly.
yeah.
So somebody looking to be an aesthetic nurse, it could
Yes.
take them 2 or 4 years of schooling to become an aesthetic nurse.
Correct. So you can practice as far as practicing, you can practice with your associate's degree. You just got to get a little bit of training. You have to find, you have to get set up either with a larger company or start your own thing. So you get your LLC, you get all that good business stuff going in the background while you're learning. And that way you're all ready to get set up.
Got it. So right after you finished your nursing school, that's when you started your business right away, or you had a job in between?
So I actually worked at the hospital for a really long time.
okay.
So yeah, so I took my ICU training. So I used to do step down, and then I'm like a charge nurse. I'm a nursing supervisor. So I got a lot of administrative stuff because I already had my degree in business too. So I learned all that good stuff as far as being
Yeah.
in the hospital. So yeah,
Oh, wow.
I have that training too.
Yeah, yeah.
And so I loved being in the hospital, but it was getting a little sad, to be quite honest, and a
Yeah.
little bit like people are getting sicker. And
Yeah.
it's wild after a couple of years of owning my own business. Like people just like are genuinely happy that you're helping them with their face more than you are in the hospital, which is
Oh,
totally
really?
random. And no nurse does it for the thank yous. Never, ever, ever. I would help anybody. But like, it's just kind of nice to be in an environment where you're like,
You're more
people are
passionate about
happy
too.
and passionate, 100%.
That could be, I could see the hospital being sad.
It's super
yeah.
sad. It is
Yeah.
super sad.
Uh,
And like people that have known me for a while, they're like, I've never seen you happier. And I'm like, thank the, it's just like wild because you're like, I found
Yeah.
it.
Yeah.
After all this time, after all this school, I found it. So I'm so
So
happy.
you didn't go into it knowing that this was your end goal, or you did?
I didn't.
Okay.
cool.
And so, yeah, I think that that's the really cool thing about
Yeah.
nursing too, is there's so many different routes that you can go, so many different types of nurses that you can be. So
Yeah. So what made you think, flip your kind of goal and transition to this world? Because it's obviously, I mean, yes, it requires the nursing background, but it's very different world, right?
100%. I think like I was just like, where am I in my life right now? And what can I do that's going to make me happy and kind of get me out of like kind of this sad world?
Yeah,
Because I used
yeah.
to work on an oncology floor. And it was getting to be a lot,
Yeah.
just mentally, bad things are happening.
Yeah.
And just like all that inside was just like, okay, what can I do that's going to really make me happy? And also, I was just noticing the changes in myself, like my face. I'm like, okay, I need to hop on this. You know what I mean? And not that I've done so much, but my skin and all that. And we'll talk about skin a little bit more, but that's one of the most important parts. And I think until you finally realize that, then you're like, oh, okay, then I need to do it too, because it's like, yeah, it's so important.
I've always said if I wasn't a hairstylist and now owning salons, I would have loved to be an injecting nurse.
And she's gorgeous, so yes.
I love it. I'm like, oh, it's so fun.
Oh my
it's like makes you look, like you're aging gracefully.
Totally. And I think that that's the big thing. Like, obviously, Bree's face is super soft. So it's like you don't want to do too much and make her look different. So, I mean, like, she's barely gotten anything, but it's just like perfect little things to like enhance what she already has. So we're not going overboard or anything. So,
but I'd say that's why you go to a nurse and you do your research so that the nurse isn't going to like over inject you. Because for me, I was just like, I want to look natural.
Yeah.
I just want to like age gracefully and like, what can we do? And it's more like of an enhancing. And so it's just, just if you're in the Bay Area, just go to Nurse Liz. I'll do the research for you.
Make
Okay.
it easy.
So, but it's true. Like I've seen a lot, like being and also doing hair, I've seen a lot of botched, like lips, faces, bodies. I mean, you see it all. So it's just do your research. And like I said, if you're in the Bay, she's your girl.
Yeah, because you don't want to risk something like that, like you don't want to, that's like a really big thing to just,
and it's an investment.
willy-nilly.
Like this stuff isn't cheap, know, and you want to like, you really want to spend it and know that you did a good spending.
Yeah.
That you
Quality
look
over
good.
quantity.
Yeah.
Yeah, definitely. So talking more about like the services and everything, I guess what is something like a service you would recommend for someone like me, maybe that hasn't gotten and like not in the world at all, hasn't done any of those kind of appointments and things like that. Not saying that I am.
Do I sense a booking appointment?
oh,
we do
she's
your
putting me on the
consultation?
spot. I know, right?
Just like something that's for the people who have never gotten anything or maybe interested in kind of, getting into that world a little bit more.
Should we like mock the consultation right now so then they can know what to expect like when they're first in like a consultation?
Should we just do a full like appointment right now?
I know,
Throw all
like
this off the
get
table.
in my chair, right? Oh my God, I always have my black card with me. I was actually thinking about it. I was like, I never go anywhere without it, but I didn't bring it today. I brought you guys some little skincare goodies, but I didn't bring my Botox or anything. Yes.
Okay.
Funny.
So somebody who has never gotten it and what to kind of expect.
Yeah.
Definitely. So I think for you, if you're coming in and asking me, like you're a young girl, I don't even know how old you are, but we won't talk about that. But I think for you, something that would be great would be like microneedling. Okay. So when I look at you, even though your skin is gorgeous, right? So we're looking at tiny little fine lines. You know what I mean? Even when you smile, we were talking about a lip flip. I don't want to put you on the spot here because you're obviously gorgeous, but a couple of tiny things, like we said, that can enhance or anything. But like, skin is something that no matter what, no matter who, like you always want that to be popping, right?
Yeah.
And so, like I said, I'm working on mine. And so I feel like as we age, even past the age of 25, like your collagen bank drops. And so this is something that's all natural that is going to like affect you even for years to come. And for someone like you that doesn't even have hardly any skin issues, I think like even the girls that look fabulous, like all these NPs that are on Instagram that you might follow, like they're doing these treatments 4 times a year and their skin is fabulous, right? So it doesn't mean like, oh, I have great skin, I don't need to do anything. It's like that maintenance, even if you got 1 or 2 a year, I think that would be amazing. And so let's just say we were to microneedle you today, right? We would do some cleansing first. Like before you even came in, we would talk about like some of the things that you're using as far as skincare products. So like your retinoids, anything that you're putting on that has any type of like active ingredient, we want to stop those a couple days before, 4 to 5 days before. And then the day when you come in, we'll clean your face and then we'll go ahead and numb you for about 15 to 20 minutes with that really good numbing cream that we were talking about. microneedle, draw some blood, reinfuse that. So that's like a PRF. They used to call it like a vampire facial, but it's like a microneedling
Yeah,
PRF.
it does look gnarly on
A little bit. When I post on
Kinda scared me
Instagram,
at first.
I know, I ain't gonna lie. So my husband's like, that's not cute. And I'm like, but that's the truth. Honestly,
Yeah,
that's
yeah.
the way it looks. And a lot of
What do you
people kind of, exactly. So you need to know what to expect. And so it literally takes about 30 to 45 minutes. And so it sounds kind of not that great. It's like a little
Yeah.
machine coming towards your face. But we talk about it. It's a million micro injuries to the skin that produce collagen.
Okay.
Sounds interesting, right?
Yeah.
And then once the skin is open, then we reinfuse your liquid gold, your plasma. And then
The blood that was drawn.
that's right. We
Okay,
spin
wow.
it in the centrifuge, and then at the top, it's like a gold coat, and we draw that up, and then we reinfuse it.
Interesting. Okay, so with the micro
Yes.
needling, is it literally just like little needles and you're like
Correct.
brushing the face kind
Correct.
of thing?
So
Okay.
it's like I use Skin Pen, which is one of the most popular and most effective tools. So you just hop on, obviously, a sterile needle and one per use, obviously.
Yeah.
So, and then there's a gel that you put on. And so it helps glide over the face. And then, so it has different settings. So, like the under eye, which is like a thinner skin,
Yeah.
you would use a different setting. So, like, I had a patient on Friday. She had like cystic acne and she had a lot of scar tissue built up here on her chin. So I'm like, I'm going to go extra deep on that part and I'm going to go over it multiple times. Okay. So that way we're going to get a nice, good treatment there. But yes, so different areas for the face require different depths. And so your nurse should know that and based on your skin quality too.
Yeah. That's interesting that you brought up like the acne scars because I know like a lot of people struggle with that. So is the micro needling something that could help with that?
100%.
Okay.
And so Skin Pen is FDA approved for microneedling. And so a lot of people want to microneedle at home, which
What?
How do you do
they
that?
do.
Please
So,
don't.
well, okay. So, like,
Like
you-
a little vampire in the bathroom by yourself? Like,
so
What
there's
is going
different
on?
things that people can do at home. But just know that when you go to a provider, that this is a medical grade machine. Okay.
Yeah.
And so
Yeah,
you're not
different.
going to be able to buy anything off the internet that you can hurt yourself with too bad or like really mess up your face too bad. You just like put it in the hands of the professionals. Because if someone cranks it up to like 2.5 and is all over their face, you can really cause some damage to the skin.
Yeah. That's
I mean,
terrifying.
it's like saying, guys, don't grab the box dye off the shelf. Let me do it. Go to Nurse Liz.
Do you see what
Oh
I'm
my
talking
gosh.
about? So people come in and they're
Gives me
like,
anxiety.
oh, I microneedle at home. I'm like, okay. And then after they're like, oh my goodness, this is a real
Different.
treatment. 100%. So you
Yeah.
can't do the things at home. I mean, for the most part with my stuff, because
Yeah.
I'll have girls be
Yeah,
like,
not your stuff.
not my stuff. So yeah. And when we're done with that, I give you some cream to go home with. There's like aftercare. You don't want to go into the sun. And, aftercare is different for everybody. So, like me, I got kids. I'll go to Costco after with my red face, like, hi, I got to go do stuff, right? But it's okay.
So me.
Right, exactly.
I gotta
So,
still get a lot of shit done. So
100%. We got to go. So, like, when you leave, you have sunglasses on. Like, you're a
Yeah.
young girl. If you don't have kids, or like, I'm going home for 2 days. I don't got to, I'm just going to stay at home. I'm like, okay, that's fine. So, we'll wipe off your glasses with some alcohol. Make sure everything's clean. You want to go home. You want to change your pillowcase. If you have a puppy, they can't sleep with you. So talk to them puppies, talk to them kitties, and be like, you can't sleep with me tonight because
talk to that boyfriend or husband. Be like, you can't sit next to me.
you can't touch me. Yeah, exactly. Well, they're gonna be like, "What happened to your face?" So they're gonna
You
be
look
like,
scary.
"That's right." They're gonna be like, "Okay, I'll sleep in the other room, babe. Don't worry." So you want to change your pillowcase. You want to make sure that like you wash your brushes. This is a perfect time for like makeup application. You just want to wait 24 hours. Even to 48 if you can, to not put any makeup on. If you do go out after 24 hours, you need to put something on, SPF for sure. That's super important. And you just want to hide your face from the sun. So I wouldn't do it.
In the summer, maybe. If you're out in the sun a lot.
That's
maybe.
right. Yeah, I wouldn't do it like right before going to vacation,
Yeah.
Something like that. If you can like wear a hat and you're just around, you're totally fine. But yeah.
That makes
Yeah.
sense.
Mm-hmm.
Have you ever gotten this done before?
No, but I'm like, do I need this? Nurse Liz.
Oh my gosh.
Well, like I said, I think it's really good for collagen production. And even though your skin doesn't have major problems, it's still really good for you. Because I have my one patient, I'm in love with her skin, and she's on the dot every 6 to 8 weeks, that girl. But her skin is flawless. And like I said, you see these girls and
Do you think it's because of that?
I think she kind of started off with good skin, but she maintains it, And like I said, these girls that you see on Instagram, like they're just like doing the most. They're doing it to keep up, right? So I would say for someone like yourself, I would recommend like probably 2 a year, just because, kind of one in the beginning, 6 months later. But if you have like a wedding and or like you're getting ready for an event, I would say let's do 3 in a row, like 3 to 4 months before it gets started, and your skin is going to be like glowing.
Oh my gosh, I want to try this.
I know. And I always tell the girls, if you have like the sooner you start, especially if you have acne, oh my gosh, please come. I love it because like once you see your skin and it's so much better, like you have the whole rest of your life to live with it. Like this isn't going away.
Yeah.
Right? Like the benefits aren't going away. So I'm like, oh, I want to help you.
I know.
Do I need this?
Especially
do we make
with,
a reel and do this?
I think so.
So we can like have
I
a
think we
follow-up
do.
on this?
I think you're going to love it. I honestly feel like no one has ever not loved their microneedling. There's not
Really?
one
Yeah.
person. Like you can't be like, oh my gosh, like.
Will you see results after the first one, you think, or it takes a couple?
I would say 2 is best,
Okay.
right? So pretty much with anything, you want to get a couple, just like, like, okay, I go to the gym one day, like, what am I going to see? Like, not much, right? You need to kind of like back it up with a little bit more. I wouldn't say that you wouldn't see results because I firmly do think that you will, but it might not be as evident until you're like on number 2 where you're like, it's popping.
Yeah.
Yeah.
I think you need to do it, Bree.
I think you need to do it.
Oh my gosh.
Do we both do it?
Oh my gosh. Now I'm scared.
Oh my gosh.
So many people are scared. And I think once you do it, then you're like, oh,
Wasn't that
okay.
bad.
Yeah.
It wasn't that bad at
That's
all.
true. That's true.
And she does like bougie numbing cream. So
True.
That's right. We're working with some really good numbing cream, but
Yeah.
I think that is a treatment for everybody, right? So if you're like, okay, what can I do? Like I said, your skin is number 1, right? We see that no matter what on every single person. And so tiny fine lines, even under eye bags, discoloration, tone, texture, all of that is so much improved.
Yeah. And I feel like, just the skin is so important. And I feel like for me, when there is something wrong with my skin or I am having a breakout, like that's all I can think about the whole time. You know what I mean? So it's like, it's so important to make you feel like more comfortable and confident when you're like doing certain things, you know what I mean? Or just going out. So it's like investing in your skin is like so important because you can't, I mean, I don't know, people rip their whole face off and get new skin. I don't think you can really do that. So
That hasn't come out yet.
yeah, so
Danielle, are you onto something?
I was going to say,
I mean,
her left butt cheek. No, I'm just kidding.
seriously.
I mean, you never know, right? I mean, you're going to have your skin till the day you die. So
That's
you
right.
got to take care of it.
That's why when people always ask me, I always say microneedling because it doesn't matter like how old you are. It doesn't matter your skin quality. It can only get better.
Yeah. Interesting. What do you think is your favorite service to do?
So I think for me, like microneedling on like acne skin because they just see such good results.
Yeah.
And that honestly makes me happy. And I think in the beginning when I first started this, I was so used to being a nurse and like helping people instead of like the beauty aspect of it. So I used to love doing TMJ Botox because like people would come in and they're like, it's hurting and like they're grinding their teeth that night. And so literally we would just inject them and they're like by day 3, they're like, it's so much better. Plus a lot of people are using it for facial slimming. So if you have like a square face, we inject here and then you're going to get some facial slimming, which is also beneficial. So
Yeah.
I like to do
I
that.
just recently heard of that one.
Yes.
How does it change your face though? Your face shape?
So what happens is like your masseter muscle is your strongest muscle in your face, right? Because we're chewing. And so some people just have like a really
Like a more
large
defined-
muscle. Totally. And the
Oh.
definition of your face too. So like if you just put your finger here and clench down, like right here, clench down. And if you feel it like popping out,
Where?
like right here, like right on the side, right there.
Okay, show the camera.
I don't really
Oh
feel
yeah.
anything.
So okay, if we're right here and you're putting your finger here, I don't have it, but like some people, like your finger will go out
goes
like
out.
that. Totally.
Oh my
So
gosh,
for
I think I feel it. Well, I don't know. Now I'm scared.
no, it's okay. I mean, you don't have to fix it, but if it hurts, this is definitely like, let me see, babe.
My finger's definitely moving.
So your finger, see you. So
Yeah, but I have
you-
chubby cheeks, so that's why you don't see it. You know what I mean? Like you
Yeah.
don't see it come out so much. But yeah, you
Mine
can
is
feel it.
moving.
You're,
I'm
see?
scared.
See,
Yeah.
you can see her fingers moving. Oh, totally. See, look at Bree's fingers.
Yeah.
You see?
Yeah.
So when people have that, then that's when you can have a little bit. You're like, okay. So that's.
Bring your stuff.
Well, dang, I should have brought everything. No, but that's definitely when you can have a little bit more facial slimming going on because you could see that that's an overactive muscle.
Wow.
And for those people, but if you have pain, you're grinding your teeth, people are like breaking their teeth or people wear night guards all the time. And so this is like a simple fix.
Does that impact your smile at all or the change of your face?
So if you TikTok like botched masseter muscles, sometimes you'll see it's a specific injection technique where you have to get all the way into the belly of the muscle and slowly retrograde out. That means the whole muscle's getting.
Does that hurt?
That
It
sounds
doesn't.
like it hurts.
It doesn't.
Oh,
I
thank
know it's
gosh.
wild, but these people, no. We put a little ice on that one. We didn't have to numb for that because it's
Yeah.
going so deep. It doesn't really hurt that much. And it's 3 to 4 different injections because it is such a bigger muscle. So that used to be one of my favorites in the beginning. So it's microneedling that. And
yeah.
honestly, Botox just works.
Yeah.
You know,
Yeah.
Botox is a household name. So I'm sorry. If you need a refresh, honestly, some quick little talks, and we're looking just more relaxed, more refreshed.
Mm-hmm.
And I'm really loving PRF for the under eyes too, because I think the girls and the Easy Gel, I think the girls are like really struggling with their under eyes. And even if you use like the under eye creams, we need something a little bit more
little
effective.
more, yeah.
So
Well,
like the under eyes.
And
Mhm.
let's talk about, because it kind of coexists in my world.
Yes.
I think it's called PRP.
Yeah, PRF, PRP, pretty similar.
The hair injections.
That's right.
So I have some clients and, people that are thinning around your hairlines, or even we're going to ask Nurse Liz here. They get like kind of like a bald spot somewhere in their
Totally.
head. And I've had a few throughout the years of my career that have this.
Mhm.
Well, now what's really cool is there's a service called PRP or PRF. And that can help people thinning, or if you just feel like, you're like fine around here, it can help stimulate more hair growth. Yes? Or tell us more.
Correct. So it stimulates the hair follicle. So PRF hair injections is getting really popular now. You see a lot of people even going to like Turkey and all these different places to get their hair replaced, or like, I mean, there's a lot of different places here too, but it's really
Yeah.
popular because it's a little bit cheaper out there. But if you want to go the more natural route, it would be to do PRF hair. And so when you're looking at a place, you want to make sure how many tubes are pulling, because the more product you put in, obviously the more benefit you're going to get. But what you do have to have is a hair follicle.
If you're bald and your head is shiny, okay, it's not
It's
going
not
to
gonna
work.
work. But if you're talking about like what Bree said, you have
Just
a little bit
finer.
more finer hairs in the front, or you're thinning a little bit.
But you still have a few little hairs sprouting.
But you still
There's hope.
There's hope. Okay. And so, yes. So basically, again, what we do is we pull your blood. I do 4 tubes. We spin it in the centrifuge, and then we get that liquid plasma at the top.
Liquid gold.
Liquid gold, baby. And then we put that back into the area that you need. So just to be transparent, you do need at least like 4 treatments spaced 4 to 6 weeks apart. Sometimes, 6 is like the best, right? So you want to make sure you get your appointments. We're getting them set up because if you do one, you're not going to see anything. But after I have my patient, like she's on her 3rd one, we have baby hairs all up in. She's like, should I get bangs? I'm like, I don't know. I'm going to have to send you to Bree because like, she goes, what should I do with this? Because now it's like
That's
all
great.
I know. I was
Yeah.
so happy for her. She was postpartum.
Yeah.
And there's a lot of different things that you can do. But like, I was like, a girl, go see Bree. Because like, I think like, I don't know, bangs might be the thing, right?
Yeah.
Because like all of a sudden it's all up in this area, right? Where she wanted it. So I'm so happy for her. But we need one more treatment. And then after that, you probably can come back once a year to get like a follow-up. And then we go from there.
That's so cool. I've literally never heard of that. What does the PRF stand for?
So platelet-rich fibrin.
Okay.
Yeah. So
Something
this
with the
treatment is
cells.
great for anybody that has thinning hair, postpartum mamas, or men that are starting to lose
Dabs,
their hair. Like,
or-
you know,
yeah.
you it'll help. As long as you're not shiny,
That's
there's hope, and you guys
Mhm.
can get this done instead of going in for like a hair transplant, like she was saying.
Correct.
Interesting. I've literally never heard of that. There's
Yeah.
so many different services.
There
Goodness.
really is.
Yeah.
And so you want to kind of pair it with probably some minoxidil or Nutrafol. You want to make sure that your scalp is nice and clean. And so there's different things that you want to do in conjunction with that. But the PRF really stimulates the hair follicle to bring it back. So yeah.
Interesting.
I'm telling you, Nurse Liz has a magic
Yeah.
wand and can help anyone.
Literally. Any problem. Just
Yeah.
she waves her magic wand.
We're
and it's
working,
fixed.
we're
Yeah.
working.
Oh my gosh, I love it. Well, I mean, that was a lot of great information. Are there any other questions you have, Bree?
No, I think you kind of hit all the
Yeah.
cool key parts that I was
So
hoping.
much.
Like anybody that's new that's looking for Botox or
Mhm.
like the difference between lip filler and getting a lip flip and PRP.
Yeah.
And what I guess I need to try the microneedling.
I know.
That's
So,
right.
And like joining the industry and all the schooling behind everything. I mean, yeah,
Mm-hmm.
you shared a lot. Is there any last like points you'd want to touch on, or like any last words of wisdom that you would want to share to either those who are looking to join the industry or those who are looking to,
Be your next client.
be your next client. Pitch yourself.
Yeah, oh, for sure. Thank you. So I think if you guys have any questions as far as like my new nurses out there, I'm here to help. I think it's such a good industry to go to, whether you're in aesthetics or at the hospital, you're helping people. Number one, that's huge. As far as my services, I'm super, conscientious of like what's going to make you look the best and the most natural. We're not trying to do anything that's going to be too much or really change your face. And honestly, if it's not going to work, I'm going to tell you no, because number one, it's not good for you. And number two, it's not good for me. Like we all know what doesn't look good, and I think there's different beauty standards and like there's a lot of trends. And so we try not to hop on the trends so much as far as like what looks good on this person or what looks good on that person. It's more about what's looking good on you. And just remember, the natural products are amazing, but they do take a little bit of time. So, this isn't always a quick fix. Like Botox, yep, we're on it, right? A couple of days,
Instantly.
we're looking. Yes. So not everything is a quick fix, but if you stick with it and are super consistent, then I think that you're going to get to where you want to be.
That's so great. And just as a reminder for them, so they can find you on Instagram, they can book with you on Instagram, or where else can they find you?
Yeah. So my booking link is through Gloss Genius. I'm at Vital_Therapeutics. You can find me there. You can always DM me any questions. I'm available. You can call me. I'm both mobile and in office. So for more of our procedures that we have to get really like access different areas, especially like the under eye for Easy Gel, we're definitely doing that in office. So, but yes, I can come to you.
Office is in Fremont.
I was going to say,
Correct.
where's your office and where do you travel?
So I travel usually from like San Jose to, I'm usually like San Ramon, Danville, Pleasanton. I'm always in Pleasanton. So I know I was talking to Brie. I'm like, you got a space for me, girl? Because I'm just like,
Literally.
I'm like, who has a space for me? So I'm out there a lot.
Yeah.
So I kind of just try to like batch my bookings, especially if they're mobile. So we're getting multiples. And so, but yeah.
Nice.
We're also in office as well.
Now,
Awesome.
everybody, you heard it here. I just shared with you guys my
Her
secret
secret.
sauce. So you're welcome. You don't need to do the research. She is your nurse here in the Bay Area, Nurse Liz.
Thank you.
Vital
Thank you
Therapeutics.
so much for joining.
Thank you, babes.
Yeah.
Alrighty, and that's it. So thank you so much for tuning in to
Salon After Hours.
and we'll catch you on the next episode.